Welcome. I am Dr. Patrice, licensed clinical psychologist, and here I share educational information related to psychology and law. And today I wanted to take a step back and talk about how to find a therapist. The difference between a social worker, like all the different types of therapists. And I'm streaming from my phone. And so y'all might see me kind of come up a little bit. And so, welcome, Sarah. Welcome to everyone that is watching. I might do this video again later because I really wanted to do it from my laptop, but my laptop is at the office and I'm at my home office, and it is not worth it to try to drive home to get it. And so, yeah, we're here, and I still wanted to talk about these topics today because I think they're really important. If y'all have questions, please let me know. And so, a symptom of ADHD is losing things, misplacing things, not having things. I welcome Phoenix, welcome everyone. Thank you to the person that loves the chair. So, I did like a happy dance when I found that chair. It is, and this is my home office. So, this is like my personal chair. Clients do not get to sit in that chair. It is from IKEA. I paid way too much for that chair, but it makes me happy. So I have a bit of a coastal theme throughout certain parts of the house, and so this very much gives, a nice coastal theme and a pretty awesome pop of color. So I love it. So with how to find a therapist, there are a ton of websites that you can use to look for a therapist. If you Google psychologist in my area, therapist in your city and state, the website psychologytoday.com will most likely come up. Psychology Today, it's a directory that therapists pay to be on. So it's free for clients to search. The therapist on that site, they all pay to be there. So every therapist in your area is not going to be on Psychology Today. My practice stays fully booked, and so I don't have a listing there. There is another site called Therapy Den, Therapy DEN, and that is a site that I sometimes use as well. On Psychology Today, sometimes therapists will check that they do everything. And that's a bit of a red flag for me. It's like if you work with everybody, you do everything, you just like that's I don't know that a person can do everything well. So I like to know what a therapist, what their specialty is, what types of clients work well with them, what kinds of clients do they refer out. And we will get to some questions and things that you can ask a therapist a little bit later. And a friend of mine, My Destination, she's over on TikTok. She developed a resource, a website, and I will make sure after I go back to put that resource down in the description. Today, I don't know, like I finished my week and I didn't do any of the things, but we are here. I will make sure to add the websites that I'm talking about once this stream is over. And and so with looking for a therapist, it doesn't really matter. Like if you're looking for counseling, if you're looking for somebody that does EMDR, and I will break down different types of therapy a little bit later. But if you're just looking for somebody to sit down and talk to, we're all trained to do counseling the same. So, as a psychologist, I don't do therapy better than a licensed clinical social worker or than another licensed mental health professional. And the reason why I say licensed is because sometimes school counselors, or individuals who are social workers for, excuse me, for CPS or for a hospital. Like there's some people, they're social workers, but they're not licensed as, like, they're not licensed to do therapy. And there is a bit of a difference. So normally somebody that's doing benefits at social services, they're most likely going to have a bachelor's or a master's in social work, but they might not, they're most likely not going to have a license to practice. Their supervisor is most likely going to have a license, but and that's where it can get confusing when you're looking for someone. If your issue is more minor, because if you go on Psychology Today, if you go on different sites or resources, you will see people that will have like resident in counseling or pre-licensed social worker, and that is someone that is working towards their license, and they do have a supervisor. Sometimes once they get licensed, and if they were accepting your insurance under their supervisor, once they're licensed, they're going to have to go through their own credentialing process. And credentialing for insurance can take anywhere from like 1 month up to like 6 months or a year. And I was actually denied on one particular insurance panel. And I'm kind of glad that I got denied because they don't pay very it's, yeah, I'm not saying their name, so I can talk about the fact their rates are usually pretty low, and so I am out of network with that particular insurance. But they did not, like, I tried to get in network with them and they denied it. Insurance brings up cost because depending on what type of plan you have, and this can be incredibly confusing because if you have a deductible, so a deductible is the amount of money you pay before insurance pays a dime. Sometimes your insurance, even if you have a deductible, sometimes they will pay for the initial intake, but for a lot of insurances, they don't pay for anything until you meet your deductible. And I've had clients with $5,000 deductibles where even meeting once a week for a year, they never reached that $5,000 out of pocket. Once a client meets that out of pocket, then sometimes, depending on their plan, the insurance company picks up a percentage. Sometimes they pick up the tab entirely. If you have a flexible spending account, an FSA, you can use that to pay for therapy services. If and that can go towards your copay. So copay is if you owe $20 each session. If a therapist is out of network, you can always ask what their rate is. And if their rate is $150, if their rate is 175, some therapists go all the way up to like $300, and $300 is going to be at the higher end. I think what's more typical is between 100, 120 to about $200. That's a typical range. Above that range, you're normally working with a specialist. You're normally working and that's for people that have that amount of money to be able to spend on therapy. So the most I've personally spent on a therapist, I think my therapist was about 175 or 180 a session. And I think I worked with them for about 5 or 6 sessions. And thank goodness I got better. My next therapist was in network. And so I just had my $20 to $30 copay, and my the services I received, somebody that did not accept insurance versus somebody that did, I lucked out and I had a good experience. Sometimes just because someone is in network with your insurance company does not necessarily mean that they are going to be the right fit. And so you can always ask if the therapist has a sliding scale. And so sliding scale is often based on your income, and that is where they will sometimes give you a lower rate based on a person's ability to pay. And but often, so for me personally, if a person does sliding scale, then they are not able to submit to insurance because I don't want the insurance company knowing that I will, because the insurance company needs to know my real rate, so that they're not able to get reimbursement if they do request that sliding scale rate. All right. There was a good question. So PMHNP. So I know that's like probably a medication nurse practitioner. They charge $350, and it might be because they prescribe. I'm not sure. So sometimes psychiatrists and nurse practitioners and medical doctors, it's because sometimes they might charge $350 for a 15-minute or 20-minute medication check. And that's just what some people charge. And so, yes. And so so for workers comp, if someone is injured on the job, and if they have if they're job agrees to pay for their therapy. Some people get it through there. There is something in the US called Employee Assistance Program, EAP. And some jobs offer 6 free sessions or 5 free sessions. Sometimes they offer a certain number of free sessions. Wow, Sarah, somebody charges 175 for 30 minutes. Wow, that is a lot. So that is really, really expensive. Yeah, that's higher than my rate. Yeah, I charge 175 for an hour and I am not accepting new clients. Okay, so that was a, yeah, psychiatric mental health nurse practitioner. So every state has different acronyms. So every state has different. So in Virginia, we have um, LCP. So I'm a licensed clinical psychologist. We have LCSW, licensed clinical social worker. We have LPC, licensed professional counselor. And we have LMFT, licensed marriage and family therapist. So Florida has LM. So they have licensed mental health professional. They have LMHP. They have, so every state sometimes has different acronyms. If you wanted to like really do a dive into the therapist, you could just check to see if they have any licensing board complaints. So licensing board complaints are public knowledge. And so I'm licensed with the board of Virginia. And so somebody could type in my name and see if anything came up. But complaints that turn into actual, like, so like if there have been complaints that have been investigated, those things are on the website. I agree that there are way too many acronyms, and each state gets to decide. So there is no national, like, for all mental health professionals, there isn't a national, like, license that you can get to practice in all 50 states. So I am only licensed in Virginia. If I wanted to get licensed in Florida, I would have to reach out to their board of psychology and work on getting licensed there. For psychologists, we do have something called Psych Pack, where there are some psychologists that are licensed in multiple states. It's something that's expensive and it's a lot of work to maintain. And so that's why I have a successful practice with only working in Virginia. So the way that licensing stuff works is that I can be anywhere in the world. My client has to be in Virginia. So I can be anywhere, but my client, because I'm licensed to practice in Virginia, my client has to be in Virginia. I can be anywhere, client in Virginia. There are states that allow for they have some reciprocity where people can get permission to practice in the state, and but the whole thing gets very, very complicated. And so um so countries with universal health care, sometimes what I've heard, so I know some people that have tried to get mental health services in the UK, and they have, I believe it's called like the National Register. and there are certain providers and they're not able to be as picky. This is my understanding. They're not able to be as picky with who their provider is. So if they're going with a provider that's approved, so they say what their issue is, and then it's my understanding that they might be matched with someone. That's my understanding of what happens in the UK. So I am for universal health care. I think it's something that would be helpful, especially for people that I think it's sad in our country that people go bankrupt for medical issues, for medical concerns, and that is just that's ridiculous. I have a family member that had a major surgery, and as we were checking in for surgery, they were like, "Oh, that'll be $6,000." And we're just like, because we had to pay our full out of pocket. And I recommended to the person to ask, like, "How much do I have to put down right now to get the surgery?" And they said half. And because there's always billing issues, like and, because yes, there ended up being issues, and we had to go back and forth with the hospital, with insurance, and it can be a bit stressful. Um, and so with all the acronyms, the biggest thing is just finding out, are they licensed in the state where you are? And um, when we talk about the types of therapy offered, what's more important is how I show up as a clinician versus what specific intervention that I might do. Because I, um, if I'm not the right fit for someone, I could do the best intervention in the world, but if they don't feel safe in my office, if they don't feel listened to and heard, they're probably not going to get better. So appropriateness of fit, finding the right person, I think sometimes that's really important. Now, if I have complex trauma, if I have a severe dissociation, if I have some specific thing that I need to make sure that this person has expertise in, if I'm going to get treatment for a substance issue or something, and I want to make sure that this person has experience working with this, then I might ask general questions. I really encourage people when they're looking for a therapist, don't get too specific about all, like before they've even said, are they accepting new clients? Are they, do they accept your insurance? Do they have availability at the time that you're available? Like to me, those are some of the first questions. And then like, what's your experience working with people with complex trauma, or what approach do you take with people with complex trauma? And for anyone that does have a personality disorder, specifically borderline personality disorder, that is one of the most stigmatized diagnoses in our DSM, where I know people that they have called around to almost every, but if their first statement is, I'm hi, my name is, I have borderline personality disorder and I'm looking for therapy, it I've known people that have had trouble finding a therapist that will accept them, which is because sometimes the therapist in their mind, they're thinking, oh, this person's going to be in crisis all the time. This person, blah blah, and this person, the therapist doesn't even know how managed their current condition is. When and if the person does need crisis support, if they do need intense help, that's where I would recommend finding a therapist that does adherent DBT, that does dialectical behavior therapy, where they offer crisis support, where there is a lot that's offered. Yes. So I am telling you from experience. And when people call me, I stay fully booked. And so, like, when I'm saying no to someone, it's never because of their diagnoses, but I do still like to try to help people find someone if I can. And so if somebody does this approach where they tell me like, hey, I have borderline personality disorder and I'm looking for a therapist. I'm like, I recommend like, hey, this is just like, this isn't you, but you might have more success if you start off with, I have complex trauma. I have I have difficulty regulating my emotions, because that's really what BPD is a severe difficulty regulating emotions and behaviors. And so being able to find someone that's skilled in working with complex trauma, working with those types, because I've worked with people that somebody else gave them a diagnosis of BPD when they were in their teens or when they were in early adulthood, and they've been relatively stable for the last few years. And they are not currently in active crisis. In the time that I've worked with them, they've never been in active crisis. And there are things, because maybe I might ask them, "What's your approach with individuals that have non-suicidal self-harm?" If that's something that's important, because often the therapy, and it's so it breaks my heart, and I get the frustration that it shouldn't be on the client to have to make it okay to find the right therapist. Like, and yet I know at the same time, if the client says things in a certain way, I can guarantee you they are going to have trouble finding a therapist. And so I actively practice. So Amber, I actively practice DBT skills. I use mindfulness. I use emotion regulation skills, distress tolerance skills. DBT, dialectical behavior therapy, was developed by Dr. Marsha Linehan. I've done a few other videos talking about it, either just in a larger video or specifically talking about borderline personality disorder. And Dr. Marsha Linehan later, years after her program had become successful and one of the go-to programs for treating borderline personality disorder, she later came out and said that she has BPD. And Diana, like this is a perfect joke, because I don't diagnose personality disorders in teenagers because I don't know what's happening in that home for sure. And there are people that I know where some of their reactions was because they were living in an invalidating environment and they had no other choice but to be there. Like, things weren't so bad that like CPS could get involved or anything like that. So I don't diagnose. Teens are supposed to have emotion dysregulation. Their brains aren't fully developed. And so I personally I do not diagnose. Now, if somebody needs a certain type of support, because sometimes now if somebody has been um like if it's clear, and if that diagnosis would help them get certain treatment options, if that would help them in a certain way, or if some things happen within our session. So I'm really slow to diagnose it. If I do ever give, I'm more likely to say that this person has characteristics of some, what do I call, characterological issues. Like, that's what I call it. I say that they're developing some problematic patterns, and that's all. Like, they're starting to show some signs of some significant issues. And so, Scarlett, that's a great question. Does CPS do anything about psychological harm? And it has to be able to be proven. So parents can be crappy parents. Like parents, and it's, does the law, have they crossed, have have they become a Ruby Frankie? Does that, like, I don't, and she's been convicted. We have all of her journals of everything she did and said. I feel like I can say it that way. Like, most people don't take it to the Ruby Frankie extreme. Sometimes what happens is people are invalidating and the environment is definitely toxic, does it reach the level of legal emotional harm? That can be really, really difficult. Something that I've personally done is if I'm working with a client that's having thoughts of unaliving themselves, and if their parent is saying things like, if the parent is being antagonistic with them and not protecting their safety, I have had to call in situations like that. And what happens is CPS gets involved for a moment, but then, like, the kid normally goes back home. Like, I've never had a situation like that where the child didn't end up back home. I'll also say again, our Child Protective Service agency, the system is incredibly broken. Where I've also seen situations where people just moved, or they fired me as the therapist. So if the parent got mad at me, let's say I did call social services on them, and they can figure it out because I only tell the parent if the parent is safe enough to not take it out on the child, and I don't always know if they are. So if I ever do have to make a call, and if the parent figures out it was most likely me, I've gotten fired before in situations like that. And um and so sometimes I'm walking this line of, has it reached the level where it's definitely about safety? Or I encourage kids, if things aren't okay, don't just tell me, don't just tell one person, tell everyone. Like, make sure that they're screaming it from the rooftops, and that everybody knows that something isn't okay. I've also had clients that have experienced horrific things in foster care as well. So the other option, so if somebody is being harmed in their home, the other option is foster care. And I've had foster parents discontinue services because they didn't like what I was saying, or because for whatever reason. Or, the foster parent didn't want to be bothered with bringing the child to therapy. The child wasn't identified as having, because there's therapeutic foster care, where often the foster parent does gets paid more and often does have to take them to therapy and stuff. And so, like, our system is incredibly broken. I want to go back up because coercive narcissism. So that I've worked with families where they know where the line is and they don't cross it, but they get really, really close. They get really, really close to that line, but that line is not crossed. And so there's nothing I can do. Like, it's not a good environment, but, like, it's not it's not to the point where I can get on the stand and say that this is causing direct emotional harm. Like, our laws regarding psychological harm are very difficult. We know that, physically disciplining children, that, screaming, yelling, screaming at a child, consistently berating a child, shaming a child, that affects the way that their brain develops, and it can produce similar symptoms as somebody that's been, so trigger warning, as someone that's been essayed. And so, or somebody that's being physically harmed. And so, the whole words don't hurt, everybody in this chat, we all know that that's a big lie. Words are so important. And children can talk to, they could call CPS themselves if they wanted to. They could tell the school counselor. They could, but just because they tell does not mean that they'll definitely have safety. Unfortunately, doesn't always mean that. All right. So with the different types of therapy, I do not do cognitive behavior therapy the way I was trained to do it. So, cognitive behavior therapy is where we say thoughts, emotions, and behaviors, they're all connected. And the way that I was trained was to do a thought record, where you identify a thought that's triggering a lot of emotions, and then you try to think of all the evidence that supports that thought, all the evidence that goes against that thought, and then you try to create a more balanced thought. And For me, that is really dismissive to someone who has experience, because it's not getting to why they think the way that they think. So I do culturally responsive CBT. I do trauma informed CBT, where I can tell, look, because cognitive behavior therapy, the way I was trained to do it, includes no validation. No validation. It's just, that's an irrational thought. This is a more balanced thought. Try to think about the more rational thought, which, like, so CBT didn't work with me. Like it wasn't. So where from my anxiety, cognitive behavior therapy does not, because I know it's irrational. Like, but I need you to acknowledge, based on your childhood, based on your experiences, based on your lived experience, I get why you feel this way. Like, I need to hear that. And that's not, cognitive behavior therapy to me was very, the way I was trained to do it in graduate school was very just like, I don't know, like it felt dismissive. I don't I don't I don't do it that way. So I integrate dialectical behavior therapy skills, because sometimes what happens, because cognitive behavior therapy doesn't teach the person how to change that thought. And so, like, to me, the skills, because I've worked with some clients where the way they're thinking, they've internalized the voice of a harmful or toxic parent. And so, if we can talk about that and identify that, and if I can teach them to be more gentle with themselves, that's often more helpful. And that's more of an interpersonal or internal family systems, or that's a different approach than just traditional cognitive behavior therapy. And so I do not do traditional CBT. Insurance companies love it. And so I I do teach clients that, like, how we think impacts how we feel. I do use some components of CBT, but I add validation and being responsive to the client's culture and their trauma as well. And so that's how I do it. Yes. And so for individuals with autism, CBT can, and also some behavioral therapies can cause more harm. And that's, I like internal family systems. I like DBT. My goal is to get certified in EMDR. EMDR, what that is it's eye movement desensitization reprocessing. Yes, yes. So, and the way that people are sometimes start is, it's, you follow their finger with your eye, or they have like two things that you click on. The goal is to have bilateral stimulation. Like I said, I am not certified in it, so like this is what I have heard, and so I am in no way an expert on EMDR. That is something that I want to get into, because what can happen is a person can get stuck with the physiological response and not feel safe in their body. And EMDR lets a person process through things without experiencing all the without it becoming too overwhelming. So it's often a more calming way. I am also open to medication assisted therapies. So I don't have any clients that have done it. But there are some like ketamine assisted therapies for depression. There is psychedelics, because what the and they're researching this for veterans, because don't do this on your own. Do not do this on your own. So this is what the psychedelics do, is it lets a person with their therapist, and it's called microdosing, I believe. It lets them process through their trauma without having the physiological response, and so they're able to reprocess everything without having all the physiological effects. And so I do believe there are multiple states where it is legal. And I am, so like, if somebody is using like I think I can say it. If people are using cannabis to help with sleep, or if they're using it to help with severe anxiety or with PTSD symptoms, especially my veterans. And there are many, many, many VAs now that are working on getting certified so that they can provide veterans with the microdosing and then also the CBD, chronic pain. Yes, it's also really good for chronic pain as well. I want to go back up to the comments. Um, okay, and so Sarah mentioned having a modified version of CBT, which talked about some good modeling skills. Yes, yes. And so, but how I described the version you were trained in wouldn't have worked for you. Exactly. So, like that whole thought record thing, which I thought was so dumb when I was being like, I was like, this is ugh. And so I had to do it for school. So I did it for school. I don't think I did it on internship at all. So thankfully on internship, my supervisor was like, she was, I don't know, like she was a superhero. She wasn't a superhero. She was trained in DBT, and she just was very trauma informed and knew a ton of trauma interventions. And her approach and everything was more consistent with what I wanted to do. And I really, really learned a lot when I was on internship. Um, Witness had lots of therapists. Only one was truly honest about everything. Her accepting of me. Oh, you felt accepted as you were. That is so awesome because and you might not even remember a specific intervention that the person did, but you'll always remember how they made you feel. And that's where I tell clients, if I'm not right for you, I will help you find somebody that might be a better fit because finding the right fit is really important. And to me, you often know from like your first interactions with the person to like that first meeting between 1 to 3 sessions, you normally know, is this the right person for you or not. And so all right, my very first therapist had an agoraphobic daughter. Wow, I'm glad that she was honest with you and open about that. And so I want to, because I like Sarah's comment about just so happening, so like that your therapist was a heterosexual male that you've been with for a really long time, and that's just happened, like that's worked for you. And I think you felt safe and supported there. And so people that are from marginalized groups, if a person is LGBTQ, if they are from a racial or ethnically marginalized group, from a religious group that is, because the therapist has to be humble of your culture. So I'll never forget having situations where I needed to tweak my services to better fit the client's culture. So if an adult client told me, I can't tell my family that they can't see my psychological. So that adult client might ask for some things to not be in their final report. And the things that they were asking me to withhold, it didn't have anything to do with their diagnosis. And they would be able to tell any future therapist and be able to process through those things with them, but it was really important that some things not be in the final psychological. And I respected that. And there have been times um, where people have needed interpreters or they've needed um, me to just be flexible with what's going to work best for them. And that's where I ask people, hey, within your culture, within your faith, is this pretty typical or is this not consistent? And that's where they'll often tell me like, oh nope, like even within my culture, this is outside the norm. And so because I don't want to put someone in my box, put someone in how I see things. I don't want to see them solely through like because the DSM-5 is like real oh whole bunch of white men. I don't know how else to put it. Like, and they've tried to be more culturally inclusive. They've tried to be more culturally diverse, but like the ways that we define grief is like, eh, so that is that is difficult. That's a great question, Diana. What is a final psychological? Is that what you mean? So I do psychological testing. One of the biggest difference between a psychologist and a licensed clinical social worker or a licensed family therapist or is as a psychologist, I do psychological testing. Not every psychologist does testing, but I do. So what I meant by I left some things out of their final psychological. I meant their final report. So because so at the end of an evaluation, I give them a document. So I have a usually 6 to 10 page. It depends on how much is in there. I assess their cognitive ability, their personality, their social, emotional functioning. I assess all of that, and we come to a diagnosis and recommendations. And so, in that final report, I've had people ask that some things not be in there just in case somebody found it. But that was thank you, Diana, for that question because that reminded me of that difference. I got a great viewer question about psychiatrists that do therapy. So, psychologist, that's me. Psychiatrist is an MD, is a medical doctor that goes to regular med school. So, psychiatrists go to med school for like the first, I think it's like 4 years, or, but their last year, they do a psychiatry residency and then they do a psychiatry fellowship. So they still do OB, like they still do all the medical training. They do all the things to be a medical because they are a medical doctor. But for that last year, they do a psychiatry rotation where they're learning more about diagnosing and assessing uh, mental health conditions and all about the mental health medication. They often work at in inpatient units. So when I did my internship, there's a psychiatric hospital in Virginia Treatment Center for Children, and there were psychiatric fellows, there were psychiatric residents, they had medical students, because all medical students do a psychiatric rotation. But individuals that want to be psychiatrists, they do additional training in psychiatry. That's why your primary care doctor can often prescribe medication for depression, anxiety, ADHD, but they won't touch if somebody is having maybe safety related issues. So if somebody has schizophrenia and their like their primary care doctor, like they need to see a psychiatrist, somebody that is skilled in the psychiatric medications. But often a general practitioner, a pediatrician might manage ADHD, minor to moderate anxiety. But as things get to be more severe, you normally want to make sure that you're seeing a psychiatrist. Now, I'll be honest with you, almost every single psychiatrist I've met, except for the ones that I follow on TikTok. Like the ones I follow on TikTok, those are the ones that are like, but like the ones I've met in real life, most of them don't have great bedside manner. And what I mean by that is like the whole meeting, they're like, okay, so this question, that question, all right, here's your script. Have a good day. And if the person's good at managing the medication, great. But sometimes I've had issues with psychiatrists not listening to my clients. And so sometimes I've written a letter like, hey, these are the things that the client is complaining of. Some psychiatrists, they don't even care about my letter. Like they're going to do what they want to do just because, like, they're the medical doctor. But to me, I take a client centered approach where I think the client is the expert on them. I'm the expert on the psychology stuff, and we partner together to find the best fit. But hmm, I've worked with and met some psychiatrists that they think I'm the expert on the psychiatry stuff, and I'm gonna give and if and you can't go in saying, "Hey, I heard about this medication. Do you think that might be a good fit for me?" They'd be like they get mad. Like they get like you can't go to them and say, "Hey, I think I might have ADHD." And they're like they will get mad if you like do and say some things. And so that's a bit of a red flag for me personally, but like, so I've had better experiences with psychiatric nurse practitioners. A psychiatric nurse practitioner is a nurse that has done additional training and certification to be able to prescribe psychiatric medication similar to, and so I'm not medical doctor, not giving medical advice, how I rationalize it, because sometimes like at the pediatrician's office there might be um uh like if they can't meet with the medical doctor, sometimes there's that very skilled nurse that they're able to work with. The name is escaping me right now, but like, yes. So that's kind of how I look at psychiatric nurse practitioners, that they're individuals that are very skilled in the psychiatric meds. In my experience, they often have better bedside manner, they often listen to the clients a little bit more. And so yes. All right. Equality. Welcome, welcome. Uh, yeah. Doctors do not like Dr. Google. Um, all righty, all righty. And so I think there are other questions. Okay, so y'all are talking back and forth. I'm gonna scroll down. All right. Yeah. So physician's assistants. Yes. So Diana talks about loving your physician assistant. I think, but it's a different word. I don't think it's physician assistant. It's somebody else. And normally I would Google it, but I'm on my phone and my computers at my office because I I've self-diagnosed ADHD. I don't mind self-diagnoses. I do like for people to be open because sometimes there are other things that present similar to ADHD that aren't ADHD. ADHD does run in my family. I have a very close relative that has it. Pretty sure I know another relative that probably has it too. And yeah, I'm pretty sure. And my child is likely going to be assessed sometime this summer for it as well. So we've it's true. So even Sarah, even my other psychologist friends, they were all just like, "I thought you knew." Yeah. Okay. And so it's not about denial. It's just, so I was raised in the 80s. Okay. So back then I was raised in a time where ADHD was sadly viewed as like a weakness, or it was viewed as like my mom would have been like, "There ain't nothing wrong with you." Like she would have said something like that. And it's like, which made me feel dumb. It made me feel like, because I always had to read things over and over. I always had to like study really, really hard. I might have a learning disability as well. Y'all will hear me talk about my visual processing. Part of that might be ADHD because I like ADHD is involved in auditory and visual, like it can impact processing, but I might also have like a learning disability as well. I do have a different family member that is dyslexic, and they were able to get help in interventions. I wish that I had received support along the way. And Nightbot gets lots of support. I'm just glad Nightbot is being nice to Sarah today. Nightbot is the best. Yes. Yeah. And so people thought ADHD was just like the kids being lazy, and 80, like they've done brain scans. ADHD is a real thing. Diana, I'm glad you say that ADHD is a superpower. So what my ADHD allows me to do is it allows me to run like multiple businesses all at the same time. Like, well, like, because if I didn't have it, because people are like, how do you do all those things? It's like, oh, like my family's downstairs enjoying like Easter, and I'm up here with the chat. Later, I'm gonna like finish my notes, and everything that needs to get done gets done. I am a bit of a procrastinator because it's just things will get done. I love all the shiny things. Okay, so that's why you can't see my squirrel. I still have my squirrel right over here. Let me see if I can turn it. Nope, wrong way. Nope, you can't see it. Maybe my head blocking it. Yeah, my head. So my squirrel is right over there for my squirrel moments because I have them all the time. All right. Yes, there was so much stigma because I wish that I had gotten speech therapy as well. My child did speech therapy because he had a stutter as well, likely anxiety, stress based, a fluency issue. And he got speech therapy. And in about 6 to 8 months, he has shown so much improvement. He's graduated from speech. And I'm glad that we got him what he needed, because I grew up thinking there was something wrong with me. So, what happens when we don't treat ADHD is it can increase anxiety, it can increase depression, it can cause kids to hate school. It can really cause a lot of major issues when people go around with it not being addressed. And so, question: do you recommend telling a therapist that you're neurodivergent before starting therapy? I think maybe asking them what's their approach with neurodivergent clients. So, like, my approach with clients is that we don't have to sit and talk. Like, if they need to write while we talk, I have adult clients that play. I have moon sand in my office, or like, they can sit on the floor. They can, like, I don't have these rules for what therapy has to look like. And sometimes you might figure out that the therapist might be a little neurodivergent too. And I find those therapists to be the most flexible because, but sometimes those, like, I don't want to talk negatively of the typicals. But all right. Your shoes have glitter on them. That's so cool, Sarah. All right, I'm catching up. Ooh, grew up in Japan, equality. Yeah. And so with um and I hope it's getting better with Asian and Spanish speaking countries as well. Well, really the whole world, because mental health is like, it's, but it can be addressed. So mental health is health. And there are countries where they will address health conditions, but it's seen as a weakness, or it's seen as negative to address mental health conditions. And so, yeah. The typicals are boring. I agree. Yes, Diana. Yes, the typicals do have different strengths. Yes. And somebody has to, like, stay on track sometimes, I guess. This is what my list is for, to make sure that I talk about all the things. So, therapist in your budget. So uh I've talked about Open Path Collective. So I dug a little deeper, and that is a company that lists therapists for between $30 to $60. I think that might be based on your income. There is a $65 lifetime membership. There's like a one-time fee of $65, but then you're able to find a therapist that's between $30 to $60. And I think it is based on your income. You can go to their frequently asked questions. This is not sponsored, so I get nothing about mentioning any of these sites. So any directories that I'm on are either free, and I don't pay for any directories right now. I accept insurance, and so I like I'm listed on the insurance. I get calls from insurance companies and emails saying, we're trying to find a therapist. Do you have availability? So I don't have to market myself like that. When therapists don't accept insurance, that's when they often have to use a little bit more marketing. Just because someone doesn't accept insurance does not mean that they're a better therapist. Just because they do accept insurance doesn't mean that they're a better or worse therapist. Every therapist has their reason for accepting or not accepting insurance. The reason why I accept insurance is, number one, I want to provide clients with affordable options. And number two, if somebody's paying $200 a session, they're probably not going to stay with me for like 3 to 6 years. Like they're probably gonna get better. Like that's what I did when I was paying that 185 or whatever I was paying. Like it was like five to six sessions. Like that was all I needed. But if he had accepted my insurance, I probably still would be working with him now. I had a good experience. It was good. Um, if you work with someone that's outside of your community. So my therapist, who was probably the best fit for me, just so happened to be a white male. I think he might have been he worked a lot with LGBTQ couples, and I didn't ask him about his orientation. Like I didn't care. It didn't matter to me. And I don't know that we shared the same religious beliefs because I wasn't there to talk about that. I was there to talk about some things that were important to me, and I was there for my therapy. So like I didn't care as long as his beliefs didn't, like, he didn't try to put his, and he didn't, like, it was a really really good experience. And I think with any therapist, you should feel like you are the one that's driving it. That's my personal opinion. It's my personal, that you are the one that is in control. So I don't tell my clients how they feel. Like I tell them like, "Hey, I might guess. I might say, "Huh, I kind of noticed this. Does that agree with you?" And they can say like, "No, like I don't think that's right at all." No problem. So what do you think? And so, yeah. Um uh all right. And so Sarah and your alter ego. Okay. um And so therapist in your budget, Open Path Collective. Sometimes there are sorry, not insurance. There are colleges or universities that have counseling centers. If maybe you just have maybe some issues at work, you have a more minor issue that you just want to work through, not major trauma, nothing significant, because sometimes you can work with them at a reduced cost for a period of time. I think when I was in the counseling center at my college, I think we were charging for students, it was free. And I think it was like 20, $30 for other people. And so sometimes if you work with somebody that isn't licensed, sometimes there's a reduced cost. They are always supervised by someone. And some red flags with a therapist is if the therapist is talking more about themselves than like you are talking about you, that can be a bit of a red flag. I do like to show up as myself. My clients will know that I have a 6-year-old. They might know. So sometimes I tell stories to just, because sometimes you put your therapist up on a pedestal, and it's like, just so you know, I have a therapist. like and you want a therapist that has a therapist, or that at least is open to their own therapy, that has done their own work, because healers, people that want to help people, often need help. I'll say that again. People that want to help people often need their own help, because they're often really good at helping other people and sometimes not so good about like addressing stuff for themselves. So that's where like doing my own work has made me a better therapist. And so now you don't like ask for the boss therapist because that was on social media. It's like, all right, so I want to go to my therapist. Like I want to get to the boss therapist. It's like that's not a thing. But um witness, that is a great question. Are in person visits better or worse than video visits? And honestly, that is based on you. So I have benefited from virtual visits, and I've also benefited from in-person visits. It's what works best for you. Now, for processing trauma and doing deep work, I think in person lets you get out of your home and bring it to an office. I've also had some clients that didn't have privacy in their home, where they like were scared about what people might be hearing, or they weren't able to focus in session. And so they've done better in person. I've also had some clients that have severe phobias of leaving their house, or where to get started, it worked best for us to work virtually. Or some clients where it's worked out for schedules that they get to meet with me on their lunch break and but they wouldn't be able to make it to my office. And I think it really depends on the individual. uh they've done research on it, and people can benefit from both. So both can be effective, often for more serious conditions, especially if we're monitoring for safety. So in person is often effective. I don't do psychological testing virtually because I want to be able to see the whole person. Y'all can tell, like, I'm all fidgety widget. Like, I'd probably get diagnosed with ADHD on a virtual visit, but I want to see the person in my office. So I only do psychological testing in person. There are psychologists that do virtual evaluations. They probably have the camera further back where they can observe the person's whole body, but no, I just have people come to my office. It's easier for me that way. All right. Um, all right. So your sister's psychiatrist supervisor comes in for the last 5 minutes of session. So I'm not a psychiatrist, and so I don't know. Uh Jody Hildebrand. Are you talking about Jody Hildebrand? Is that who you're talking about? Because that's a major red flag. Because I think she ended up doing coaching. That's what somebody wanted me to do. Talk about coaching versus therapy. Okay. Because there's some therapists that might not be licensed in a certain state, so they offer coaching. Ethically, they are not supposed to be doing therapy across state lines. So if somebody wants me to be their coach, it's not going to be for trauma, for clinical anxiety. Like, it would be more for, like, I want to be more confident at work. Like, let's work. I want some coaching on confidence at work. Like, it would be very specific and present oriented and not related to, like, it wouldn't be therapy. And I've had some therapy clients that also had coaches, that had a business coach, that had a life coach, and the life coach helped them more with the day to day. And in therapy, I address the past trauma. One of the things with coaching is that there is no licensing board. Like, anyone can call themselves a coach. Like, that's not something that's regulated. If the person does have a license to practice therapy too, then, but and some people don't. Like, some therapists have switched to just doing coaching, and they're not doing that therapy side. They're doing more of the day-to-day coaching side. A red flag for me is if somebody's calling what they're doing coaching in order to practice across state lines. That's, in my opinion, would be unethical, because yeah, you're not supposed to do that. So if I've had clients move to other states, I have helped them find a therapist in their new state, because I can't continue to work with them. I have some people that work with me when they come back from out of state and those kinds of things. And so, yes. All right. Yes. And so, witness, you mentioned finding better results in person. And so that's where it really is person to person. I have some clients that do better with virtual. A lot of my kids and teens do better in person because virtually, like, they can just start. I don't know, like, I don't have as much, like, I'm not in the room with them. It's something, I think, it personally, I think it's something about being in the room with someone. But virtual sessions might give you more options, especially if you're in a more rural area, to be able to find somebody that's in your price range, that's in network with your insurance, or that meets some of the criteria that you have. Now, if I was going to meet with a therapist to talk about racial trauma, I personally would rather do that with a therapist of color. Like, that's my own personal preference. That's not everyone's thing. I think all therapists should be trained to be culturally competent, to be not even cultural competence, to be culturally sensitive, to be responsive to a client's cultural needs. Just because I'm from the same culture as a client doesn't mean that we have the same experience. So I've had two African American therapists, and my first one, we've talked about it here before, she was not the right fit. She just wasn't. And it had nothing to do with her race. It had nothing, like, she just, I didn't like her. Like, like I don't like, it's just, we didn't connect. And I like therapists that have a sense of humor, and she just wasn't right. It just wasn't right. And so you just know when it's not right. That particular therapist was recommended to me by my supervisor that I really respected, and I had never heard someone say that a therapist wasn't the right fit. So that's why I harp so much on, like, therapist being the right fit. I want to hop back to the question about psychiatrist and therapy, because somebody mentioned in the comments about working with a psychiatrist and them doing therapy. Psychiatrists are those medical doctors that can prescribe medication. Some that don't accept insurance also do therapy, right? So psychiatrists are trained in how to do therapy. Most don't, because therapy normally pays less. So they can normally make more money. I don't know. So this is my outside view of why they normally don't do therapy, because for therapy they might get paid $200 for an hour, but for a medication check, they might get paid $350 for 30 minutes or 20 minutes. And so most do med checks, and they recommend the client find a therapist. Psychiatrists in my area are very, like, they're like, they have so many clients. They probably have I don't know, they probably have a lot of clients that they see monthly, every 3 months, every 6 months. Some people are weekly if they're adjusting medication. Excuse me. And so they often don't have time in their schedule. So a therapist, a psychiatrist that accepts insurance normally is not going to do therapy, in my experience, in the US, particularly in Virginia. But there are some that do. I know one on TikTok that does it, but he does not accept insurance. So, okay. Let's see. uh any other questions that y'all have? Let me know if y'all have questions. Yeah, so I see that a lot too. I see coaches offering sessions for healing and trauma. If they're doing psychoeducation, if they're doing education, because I follow a coach that does really good education about healing from narcissistic abuse and those types of patterns. But it's more educational. It's not working through the trauma. But yeah, and they often charge more. Coaches normally charge between like 250 to like $500 an hour. Like they often charge a lot more than outpatient therapy. And so, yeah. All right. My therapist doesn't accept insurance and does therapy. He's an MD, cool, and PhD. That's super cool, with ADHD and CRPS. That is so cool, Sarah. That is awesome. Wow. So how long would you give a therapist to see if you click? I think no more than 3 sessions. Like, like, are you, because I would trust your intuition, trust your gut. Are you wanting to go back? Do you feel connected? Do you feel like they're getting it? And if there's something that they're doing that bothers you, so like I've had some clients that said, if I take notes, so I do notes on my iPad now, but they've given me feedback for like doesn't, what doesn't work for them, and I've been able to make little adjustments. And then there's some people that just, we weren't the right fit, and that was okay. All right. Yeah. All right. So y'all are talking about y'all's experience. Ah, cool. Witness. Your current therapist might have a recommendation. Okay. So I would, because anytime my clients, because maybe somebody discharged from services and our availability just doesn't link up. I have 2 to 3 people that I know that, if they weren't my friends, I would go to them for therapy. And then there are multiple people that I know that I wouldn't let them do therapy with my dog, my imaginary dog. I don't have a dog. Like there's some people that I wouldn't see, and I don't recommend. So yes. Oh my gosh. Oh. So I just saw a difficult situation um where somebody had a really dismissive experience in therapy, and that is a huge red flag. And um if a person's in a space to let someone know, like, but sometimes you have a situation like that and you just don't go back. You cancel future sessions, and you have to kind of regroup and heal. uh um wow. I've had clients that have had negative experiences with other therapists, and as a therapist I try to say, like, it really stinks that they did that. Like, I can't believe that shouldn't have happened. That should not have happened. And it stinks that there are people out there that aren't, maybe shouldn't work with people that have trauma. Like, that's really tough. And so that's why sometimes my question is, what's their experience in working with clients with trauma? So I do yearly training to get additional training for working with clients with severe and complex trauma. That's something that I'm dedicated to. That's something that I do on a regular basis. And I take a very different approach with my clients that have histories of trauma. So, one of the things I do is on the first session, clients don't have to go into detail about their past. Like, they give me the gist of, like, childhood was difficult, I've had these types of it, but I don't go into details that first session. We don't know each other. We're building a therapeutic relationship. In that first session, we're normally talking about what the client's goals are, what's worked for them in the past, what hasn't worked for them, and then we're just trying to figure out if I'm going to be the right fit. What do you think about therapists who say they don't believe in diagnoses? So I think when people are taking that I don't believe in diagnoses apart, I think they're talking about pathologizing human behavior. So, a big reason why we have diagnoses is for insurance purposes. I'll say that again. A big reason why we have diagnoses is for insurance reimbursement and payment. Because there are some diagnoses that the insurance company won't pay for. So if somebody has anxiety disorder unspecified, most insurance companies are not going to pay for therapy for that. But if somebody has adjustment disorder with anxiety, the insurance company will pay for that. If they have generalized anxiety, the insurance company will pay for that. And so part of what that person might be frustrated with is more how diagnoses kind of is linked to payment. And for some diagnoses, because like for adjustment disorder, I normally can only bill for that one for about 6 months. And then after 6 months, we have to, if the client doesn't meet criteria for something else, we normally have to stop services because insurance likely isn't going to pay for that diagnosis beyond 6 months. And so I don't know if what the person was actually talking about was how diagnoses and payment are like intricately connected. And because even when I'm doing psychological evaluations, there is one particular insurance company that doesn't believe a full psych eval is needed to test for ADHD. So I can only do like an abbreviated version of my assessment if there's no other like anxiety, depression, trauma, if there's nothing else going on. If we just think it's ADHD, then I have to be, I'm limited with what I can do. So I think that might be part of it. All right. I hope that's helpful. Um, I do think that diagnoses can help lead to community and to people feeling seen and heard and understood, and people finding their people. And that I've worked with some clients that I met them And the language the parents were using was, they're oppositional, they're defiant, they won't do anything. They're almost like they're like a psychopath. And I was like, I think they're and I think they're on the autism spectrum, because like the person wasn't getting social skills, wasn't getting social cues. They weren't connecting with peers, and they like hated being around people. And but then there was also this history of just, they were, to me, like, I saw clear signs of possible autism. And just that diagnosis helped shift everyone's perspective away from like, this is this kid just is inflexible and is rigid. And it's like, wait a minute, they need routine, they need you to be consistent, they need this and that. And so like, it was a whole thing. And so um i I've had so many clients when they finally get their diagnoses, because for some people the diagnosis feels like validation. Like, it's not all in my head. Like, I'm not losing it. Like, there are other people that feel the way I feel. There are other people that have the same, have similar strengths, because also two people diagnosed with the same thing, it can look totally different. So that's why autism is a spectrum, because two people with that same diagnosis may present very different. And so it's tough. The insurance company is like, oh, like, I accept it because, like I said, excuse me, I want to provide an affordable option. I do not enjoy being on call with them. Great question. Companies like BetterHelp. So better, I think you mean BetterHelp. So these are just my personal thoughts. I personally would never do a collaboration with BetterHelp, because I'm not a therapist on that platform. BetterHelp does reach out to mental health influencers, to people who are psychologists or therapists that have very large followings. And a lot of the commercials that you see with therapists promoting BetterHelp, to my knowledge, none of them are therapists on the platform. They all accepted the paid collaboration to talk about the importance of therapy and how BetterHelp is an option. But BetterHelp pays the therapist, it's my understanding, pays them between $30 to $40 a session, which is ridiculously low. So for $30 to $40 a session, like, I I would rather be on Open Path Collective, and I get the entire money myself, and I cut out this middle person. It's my understanding that BetterHelp was fined by the Federal Trade Commission, the FTC, for selling client data. So it was before, I think it was 2022, maybe 2023, before they were fined and they had to stop doing what they were doing. Clients were automatically entered into the, so BetterHelp is not like, it's a for-profit app that just so happens to offer therapy, but like, their goal is to make money. The same way insurance companies want to make money, but they're bound by HIPAA. So BetterHelp, it's my understanding, there were concerns about them selling client data to then do targeted marketing, and that they were screening like the message, like they knew a client was talking about anxiety, and then that client's data could be sold, and then people could target that client with things to help with anxiety. Like, that feels icky to me. And Therapy Jeff over on TikTok, he did, if you type in BetterHelp Therapy Jeff, his video will come right up, because he called it out. And after his video went viral, that's when the FTC opened an investigation. And now people have to opt into that. But the thing that I don't like about BetterHelp is that it is the therapist can't give you a diagnosis, and they can't refer you for um, like medication management or for any other services for psychological. And you pay based on, so it's cheaper to text the therapist than to call them, than to like do a video call. So some people will just prefer to do the text with a therapist. A lot of the therapists on there, because the pay is so low, some of the therapists might not be great. I don't know how else to put it. There have been like complaints of like people's therapists being like out at the grocery store. There've been complaints. There have been complaints about BetterHelp. And so I personally, I don't like it. I don't use it. Open Path Collective. If you're looking for reduced therapy, I would check that one out. I would check that one out. Those are just what I've heard, the complaints that I've seen. Now there are some people that have had great experiences with great therapists on BetterHelp. And so if you're talking about the selling of the data, they no longer do that. Clients have to opt in to it. That's why they were fined $7 million by the FTC. So um, they don't do that anymore. But they still give people the option to opt in to having their data sold, which is like, mm, mm, mm. And I think a part of their like new client process, it's called therapy, but I think it's kind of more like coaching. I don't, because you can't have severe issues. Like you can't have severe, like if you're in crisis, they refer you to a therapist in your area because they don't want to be liable for that. And so yeah. Ah, I'm personally not a fan. It's my own personal thoughts and opinion. All right. I'll never say don't, because I think people should have their choices. Does that make sense? So, because some people have found a good therapist on there, like that is to each their own. I personally wouldn't use it. I would use like a graduate student at a college. I would see them for $20 before I went to BetterHelp. That's just what I personally would do. Uh, and it's expensive. I think it's like $60 a week for the client. And you could be working with a licensed therapist and doing video sessions virtual through Open Path Collective for cheaper. And so I'm not a fan. All right, let me see. So somebody asked a question about parents that have kids that have thoughts of unaliving or that are in crisis, things like that. And I wanted to answer that question. So for parents that have kids in crisis, making sure that you have your own therapist, that you are taking care of you, because that is an extremely stressful situation. That's a lot. And as a parent, I have to be able to be, because it's scary for me to see my child struggling that way. And and I can create safety, and I have to be able to accept the fact that my child has to want to live. And if they're in treatment, so they do. My child wants to live, they're struggling, they have things going on, they have a great support team. And with that, there's nothing I can do to guarantee that they don't do my biggest fear. So that's where I want to make sure I have them in services, that I'm in services, because I've seen some families go too far where like the parent never takes their phone, or like they never have consequences for their behavior, or like we never want them to be like upset at all because we're so afraid of that thing that we're afraid of. And it's like, how can we still have healthy boundaries? How can we have a safe place to process those fears? Um, and then also, how can we help that child develop a life that they want to live? So I've seen a lot of kids and teens experiencing hopelessness and just like that due to bullying, due to just the state of our world, just due to all those things. I would turn off the news. I would not let them watch this like horrific, like our political cycle and all the drama there. There's a lot of bad that happens in our world. We might practice gratitude together, looking for the good. As a parent, I can validate their emotion without agreeing with it. So if my child comes home and they've had a hard day and they're like, oh, my teacher's a bitch. It's like, oh, wow. What happened? What's going on? She she won't accept my late work. Oh, that's it. That stinks. You just want to talk? Or are you ready to problem solve? I just want to talk. Okay, I'm listening. I'm always here to listen. And then my child vents, they vent. All right. Are we ready to problem solve? And then they're like, yeah, okay, I'm ready to problem solve now. All right. So what are your choices? Because I see a lot of parents trying to rescue their children and keep them from ever experiencing anything stressful. So my kiddo, he just went to his very first camp. Like he had never, like it didn't work out. He had never been to camp. Um, I don't sign him up. So I signed him up for swimming, knowing he probably wasn't gonna like it. He lasted 2 times, and then it was like, oh, that was a waste of money. So for this, I found something that I was pretty sure that he would like. It worked out with our schedules, and he was anxious about it. And we prepared about like, yeah, buddy, that's this is new. Yep, this is gonna be new. And he was so excited. He had a blast. He had a great experience. It was different. So because of the work I do and also following true crime, I don't like leaving my kid with strangers. I don't like leaving my kid with strangers. Now, this was a camp with people that have been like they've been verified, and I don't know, like you do all the things that you can. And if my kid had shown any signs of like not being okay, we would have talked about it, we would have worked through it. But I can't protect my kid from anything bad ever happening to him. So the best I could do is if something isn't okay, I can try to be there and I can try to show up. I can and when I make a mistake, when when I make a mistake. So this morning, like I was feeling tired, I was feeling off, and my husband obviously overheard me talking to our son because he came up and he was like, "How are you doing?" I was like, "I'm feeling kind of tired." He was like, "Yeah, you should talk to him a little nicer." I was like, "Ooh, ooh." So my son woke up with all the attitude of like a 12-year-old this morning, and we bumped heads this morning. And so I went back to my son and I was like, was I mean to you this morning? And he was like, yeah, mommy, you were mean. And so I was like, I'm sorry. And we hugged it out. And then we also talked about like he's not always going to get his way. And even if he is giving me attitude, that I'm still going to be kind. Mommy was not very kind this morning. When I went back, I apologized. And yeah, yes, something for him and his future therapist to talk about. He will be in therapy no later than probably 11, probably before then. I view therapy as another safe adult that my child can have for support and help. I'm not his psychologist. I'm his mom. I'm his mom. I'm not. And mom, as mom, I am going to mess up. I am going to make mistakes. And when I do, I will apologize. I will make sure to, you know, do what I can, but um he might end up needing support that's outside of what I can give. And that's not me as like that's not me failing as a mom. It's just me understanding like, hey, he might need some more support besides just me, which is okay. So I hope all that's helpful. Yes. I love boundaries. Boundaries help me feel safe. And feeling safe is so important. And yes, nothing more healing than a parent that's not afraid to say, I'm sorry, I'm human, I was wrong. Exactly. Exactly. And sometimes, like, if my child is struggling, I can ask him, hey buddy, what do you need? And he might say, I want a hug. Okay, come get a hug. Or I might ask, do you need a hug? And he might need a hug. Um, and so I hope that's helpful. Thank y'all. I'm glad this, because I'm on my phone. I left my computer at work. And thank y'all for being here. I'm glad this still worked out. I will see y'all Tuesday. If you all have a case that y'all want for me to cover, let me know down in the chat. I do believe the Chad Daybell case starts next week. And so I will just be keeping an eye on that. And then there was a case of a mom that, like, oh, what is it called? It's about a box. Jack in the Box. There's a case where a woman testified, and she probably shouldn't have, but she testified in court. And so if I don't have anything else to cover before then, we might watch her testimony, and I think the jury might come back before Tuesday night. And so I might cover that one. But I hope y'all enjoy the rest of your weekend. For anyone that's celebrating Resurrection, Easter, I hope y'all have a great weekend, and I will see y'all on Tuesday. Have a good one. Bye.